And also, I have the pleasure to deliver the good news that you are becoming the winners, and we are, as part of the Changemakers team, we would like to really congratulate you and tell you that we are absolutely happy to have you on board and become winners. So, welcome. I would like to start a very short introduction, and then I will ask Jennifer and Vera to let us know better about the Saudi Crianza and Unite for Sight models, about themselves and as entrepreneurs, and tell us a little bit more. But first, I would like to start a short introduction. I will start, since I'm already talking. I'm Victoria. I'm the Global Community Manager for the Making More Health competition. I'm based in Buenos Aires, actually. And I'm absolutely happy to have you all here. Chloe, do you want to follow me?
Sure. Hi, everyone. My name is Chloe Feinberg. I work with our Changemakers team. Congratulations again on winning this competition. I've been involved with health-related efforts at Ashoka for about 3 years, and have been working with Changemakers for about 6 months on our knowledge team. So I get the pleasure of looking at the knowledge and information that cut across the entire competition, and so have read all of your entries, and I'm quite happy to be here. I'm based in Amsterdam, the Netherlands, so if you're ever passing through, do let me know. Ava, do you want to go next?
Sure. My name is Evangelia. I also go by Ava. You might also see me online as Emily. I work with Changemakers as a media manager. I do a lot of the social media work here and content creation, but really what that boils down to is creating and building relationships between organizations and people. And I love it here. I've been here for about 1 year, just over 1 year at this point, and I'm looking forward to the next.
Okay, Jennifer, would you like to follow?
Can you hear me?
Now yes.
So I'm founder and CEO of Unite for Sight, which provides eye care for patients living in extreme poverty in developing countries. And we also have other program divisions as well, such as a Global Health and Innovation Conference, chapters in North America, and Global Health University. And I'm very excited to be here this morning.
May I go now?
Yes, well, go ahead.
Are you listening to me?
Yes.
Okay. Hey people, I'm Clarissa from Next to Billion, Brazil. I live here in São Paulo, and first, congratulations for winning this challenge, and I'm really happy to be here now.
Thank you, Clarissa. Then we have also Vera. Would you like to introduce yourself?
Yes. Thank you so much. I'm Vera Cordeiro. I'm the founder and CEO of Saúde Criança. And I'm very happy to participate in this competition and also to win, to be one of the 3 that won the competition. Saúde Criança has a holistic approach to deal with poverty and health. We work in 5 areas, and we are working in 6 states in Brazil. We have influenced public policy in the city of Belo Horizonte in Rio for the benefits of millions of people. I want to deeply thank Cristiana Veloso and Hank, who did the application, and all the volunteers and staff around Brazil that work in this Saúde Criança project. And I want to thank the Changemakers team and also Ashoka for this competition. It was a hard work inside the institution, a lot of vibration, energy, but a feeling, the best for me about this award is the feeling that more and more people will be able to have awareness about our family action plan. That is the DNA of our work, that include the poor among the poor, and we are sure this can benefit millions and millions of people all over the world. So I also again to congratulate the other winners, and and Ashaka and Change Makers team, that I can feel your effort, to improve each year, and it is very important for us as social entrepreneurs to have our methodology known by many people all over the world. I think change makers understood the way to spread out the wonderful work that many people do all over the world.
Thank you very much, Vera. We really appreciate your comments. We are trying to do our best, and this kind of feedback really fills us with happiness. So thank you very much. Hank, would you like to introduce yourself?
Hi, my name's Hank. I am a recent graduate. I'm doing a fellowship here with Saúde e Criança, and I'm a volunteer in fundraising, and I'm very honored to be able to talk about it.
Thank you very much, Hank. Daniele?
Hello, everybody. First of all, congratulations. I'm the community manager in Brazil. This is the first competition that I have been participating in. It was very exciting and very touching. I think that we get to know initiatives from all around the world, and that's the kind of thing that makes us go forward. So I am very happy and honored to be part of this group. Thank you.
Excuse me.
Last but not least, Cristiana. Yes, go ahead,
Yeah.
Go ahead.
Hi, I'm Cristiana. I'm COO at Saúde Criança. I've been working at Saúde Criança for more than 12 years, and it was great to participate in this competition, to see the wonderful work that lots of people are doing all over the world, and to see the team of change makers so excited and doing so much to show this work to everybody.
Thank you, and Avia, would you like to remind us how to improve our experience here?
Yes. So I just wanted to take a moment to first of all thank you all for joining us. This is a very exciting group of people, and we just recently have gotten to know this Google Hangout tool and find that it's a really great way to bring people together and give them an opportunity not only to talk about the great work that they're doing, but really to connect with each other and give you all an opportunity to see what your colleagues around the world are also able to accomplish. I think
and we have Simon. I'm absolutely happy. Simon, welcome. Simon Shane, yes, welcome. Would you like to? We just finished our introduction run, and because we didn't know if you will make it, we are very happy you finally can make it. Would you like to introduce yourself?
Okay, yes, well, Simon Berry and Jane, we run the Colour Life project, and we're sitting here in lovely Lusaka in Zambia.
So welcome, and Eva, would you like to say again for Simon and Shane what you just mentioned about the Hangout?
Sure. Well, for the people who just joined us, my name is Evangelia. I also go by Eva. I've been with Changemakers for just over a year now and manage media for our competitions. And we just recently got to know this new tool that Google has created called Google Hangouts, and we find that it's a really great way to bring all of you together, not only to talk about the great work that you're doing, but to hear about the amazing work that your colleagues in other parts of the world may be doing, and talk about maybe similar challenges or successes that you're noticing. So for us, this is really just a great opportunity to hear from you all, and to give you an opportunity to connect with with each other. So having said that, I just wanted to give you all a few pointers as we move forward with the conversation, and Chloe gets started with her questions to you all. Just keep in mind that there may be some delays when certain people are talking. So in order to prevent from people talking over each other, just go ahead and wait just 1 to 2 seconds before you start speaking, just to ensure that the other person has finished. Beyond that, enjoy yourselves and have fun.
I would like just to tell Simon who we have here. We have a very talented crowd here participating. We have some of the team of Saúde Criança, Vera Cordeiro, who is one of our most recognized fellows in Latin America. I have been in Sugar for many times and have been here about Vera's work in Brazil for a long time. And we have Hank and Cristiana for the Saúde Criança team. We have Chloe Feinberg, Eva, who already talked, Daniela, and me from the Changemaker team. And then we have Jennifer Staples from Unite Foresight from the US, and Clarissa Barbosa, who is part of the Next Billion, who is a very prestigious social media, a special focus on social business. Clarissa is based in Brazil, but Next Billion has operations in almost many countries in Latin America, I think. So to start, I would like you, for the 3 winners, to let us a little bit more in something like 3 minutes about. We would like to know you better. We would like to know better your models. What was inspired to you to run your models, and how, in general terms, how was your experience participating in the competition? So, Jennifer, would you like to start?
So, Unite Foresight, and can everyone hear me? Just want to make sure.
Yes.
Okay. Unite Foresight works with local partner eye clinics to provide eye care for patients living in extreme poverty who previously were not able to access or afford the care. And we partner with clinics that had previously been in existence, providing care for regular private paying patients. So the patients who didn't have particular barriers to care, they were able to transport themselves to the clinic. They knew that they should get eye care. They were able to pay for their own care. So the regular patients who didn't have those barriers. We then partner with those clinics to provide care to patients living in extreme poverty in villages who have many barriers to care, which of course includes transportation barriers, cost barriers, fear barriers. Also, of course, many of the patients are not even aware that they can have sight restoring surgery if they have cataracts, for example, or that they can get glasses or medication for their various eye care needs. So we partner with just amazing, genuinely dedicated local ophthalmologists and their local ophthalmic nurses and local optometrists to bring eye care on a daily, year-round basis to villages. And there's also constant continuity of care. So the patients or the villages that are visited one month are then visited the following month. So if they visit July 1st, they'll be back around August 1st, around September 1st, so that the post-operative patients who received care, surgical care the previous month, can receive their important follow-up care, and then also so new patients can be constantly receiving care. And on a daily basis, each of the eye clinic's outreach teams provide this care to about 100 to 300 patients each day. And we work with just incredible, wonderful local ophthalmologists and their teams to be providing this type of care for the patients. So that's a very quick and broad overview about its international programs. And it's been wonderful participating in this Changemakers competition, from submitting the application to also the voting campaign was very exciting, and of course receiving the exciting news a few days ago as well.
Thank you, Jennifer. Simon, Shane, would you like to follow up, telling more about yourself and Color Life?
Okay, so I'll just explain it with a prop, if I may. This is the Coca-Cola crate, and in there is medicine. That is a prototype for an anti-diarrhea kit, which WHO say all mothers should have when they give birth, particularly in developing countries. And we want to create this as a new commodity which people can buy anywhere they can buy Coca-Cola. The purchase of these will not be linked to Coca-Cola in any way. We're just using the Coca-Cola, or the space in Coca-Cola crates, as the distribution channel. So we want to create this as a new commodity, as a something that women know about, caregivers know about, and want to have. To pump prime the whole system, we are distributing vouchers to mothers and caregivers in remote communities, and they'll be able to swap that voucher at their local shop for one of these. So they'll tip free, but the retailer will get rewarded for taking it there. In other words, they'll get their money back and make a small profit. Do you want anything, Jane? Get contents.
Yeah, the contents are going to be 2 ORS sachets, a blister pack of 10 zinc sachets, information materials about what to do when your child gets diarrhea, and also a small bar of soap, partly as a gift, but also as a reminder to mothers to wash their hands more often when their child has diarrhea. And we're also doing what we can to make the actual container itself usable, reusable, and useful for women in rural areas where it's very difficult to get containers, plastic containers to put things in, like sugar or salt or medicines or even your money or your mobile phone. And in our initial groupings, we found that women very much like the idea of having a small plastic container which they can reuse. So we've gone away from our original idea of making it biodegradable, and we're focusing on making it valuable to the mother as a package and make it reusable. And we have some other exciting ideas about that for the future that we can't trial at the moment, but we're going to look at later down the line.
We feel we're operating in the area, or everybody else feels we're operating in the area of innovation, and innovation is needed in the area of child survival, because at the current rate of progress, it will be 185 years before mortality rates in sub-Saharan Africa are at the levels that they are in Europe and the USA today. So we need innovation in this space, and we want to be part, or want to try and contribute to that innovation. We are also, like Jennifer, very excited about being chosen as a winner, and it will do us a tremendous amount of good being recognised in this way.
Yeah, just to add there that neither of us have a medical background. We did used to live and work in Zambia in the late 1980s, which was when Simon first started badgering me that perhaps Coca-Cola could carry medicines. We got nowhere at that stage. It was only 3 years ago that he persuaded we should try again via using Facebook and social media to get the idea out there. So what we do really is convene the expertise from all other partners and build the alliances that we need to make something such as this work. And we feel that's our main skill. It's stakeholder development, it's innovation, it's partnership building, and it's researching all of the different parts that you need to bring something like this together. Okay.
Thank you, Vera. And would you like to follow up? And Christian and Hank, if you want to add something to what Vera is going to tell us, just let us know. So, Vera?
First of all, I would like to talk about my emotion, to see all those great work that Color Life and Unit for Sight they are doing. You are not only doing a work that's really, really wonderful, but I think you don't realize, but you are changing the world. You are changing the way the world is king. You are changing the way the establishment, the status quo is. So I'm a physician and I worked 20 years in a public hospital in Brazil. And I realized there's a vicious cycle: poverty, hospitalization, re-hospitalization, death. And the real cause of mostly of the disease is not the bacteria, the virus. It is the living condition where the very poor people live. So, for instance, it's rain inside the house, there's no job, there's no food. So all the medical care that we do in many hospitals all over the world is unfortunately has some limits. So we saw this vicious cycle and we realized that we have to conceive, to create a new organization, not to substitute the government, the hospitals, but to help to complete the mission, to have the whole psychological, social, and bio, to see the person as a whole, as a systemic way of life. So what we do exactly? We do the family action plan. We joke that we are the government of the civil society because we work in 5 areas: education, improving the house, the health area, buying medicines for the very poor family, citizenship, trying to get documents for the very poor, and income generation, helping the mother, the very, very poor mother of very, very sick children, to have their own income generation in their poor community. And I remember the time that people say, "Oh, Vera, you have no focus. You have to focus in one thing, like housing, income generation." And because our methodology is based in what we learn from the people we serve, we never give up. We have no focus at all. And now I think we are in the right path, because as poverty is a multidimensional problem, you have to have a multidisciplinary approach to really transform people's lives. So the impact of our work, it falls down in 60%, the re-hospitalization of the children. It has an income generation, increase of income generation in 35-40% before and after Saúde Criança program. We are a franchise model. We are spreading through a franchise model. We're scaling through a franchise model, and also by influencing the government to do the family action plan. So basically, is this, and I want very much to thank my colleagues, and I want to listen from them, from Jana Veloso, our COO here in Rio de Janeiro, Brazil, and the wonderful student. He will be a doctor for the benefit of the world, and he is now our trainee, did the application. So, Cristiana, please help to add things.
Christian, I think you're on mute.
Try again.
We still can't hear you, Christiana.
Maybe try removing your headset. Let's see if that helps. Oh, that is so funny.
Sorry, I don't know what happened. I wasn't on mute and I don't know why you couldn't hear me. But I was trying to say that we try to do lots of things for each family. Each family stays at Saúde Criança for around 2 years. And to do that, we have to think a lot about the sustainability of Saúde Criança. So we have a social business. We sell products that are done by mothers that participated in the program in the past, and we sell them in kiosks in malls in Rio de Janeiro. And we also build a trust fund so that we can know that Saúde Criança work will not end because we don't have sponsors for our project. And with that, we are trying to spread our work all over Brazil. Vera's dream is to have one Saúde Criança near each public hospital here in Brazil and in the future around the world where this kind of work is needed.
Great. Thank you very much for this very comprehensive explanation. I love the exchange of the both of you. You can both, if it's easier for you, you can sit together and do it from one computer if you prefer. But it's always entertaining to see you coming and going. Chloe, would like to start with the questions. Some of them could be already been addressing by this very comprehensive and interesting introduction, but go ahead and we have many things that we'd like to know from you and your models.
Entire group. One of the questions that I had just hearing you all speak and reading through your entries is that it's quite obvious that you all excel in the ability to really truly understand the needs of the community, whether that's the partners that you're working with, or the clinics that you're partnering with, or the individuals that you're helping to serve. Can you hear me now? Yeah, you can. Okay. So one of the things, so it seems obvious that the models are quite different, but you're serving underserved populations in a way that you can just tell that you understand what people need and what different types of stakeholders needs at different levels within the community. So I wonder if we can just start off with an exchange between the groups about what are your approaches for really getting to better understand the community needs. As often we'll see health innovations around the world that are really innovative, but sometimes they miss the mark. And I think something that is present here is that you're all filling a much needed gap in new ways. And I would love to hear about how you design your programs and how you engage with your communities to really learn what is needed. And I'll just open the floor to whoever would like to respond first.
Maybe we could just respond to that, because in a sense we're the youngest of this group, I think. Although we've been working for quite a long time with the idea and developing the idea, we are starting to trial it hopefully in January. But our approach has been to be very open and transparent about what we do, and to be open in a way that enables people to challenge us and also to contribute their own ideas. This is a process that people call open innovation. So we put the bare bones of the Cola Life concept online about 3 years ago, and thousands of people have commented, challenged us. We've attracted some of the best brains on the planet in areas of public health and public health logistics. So I don't think there's a question that I haven't been asked about Cola Life several times. And when we get challenged, we're always, or certainly at the beginning, we were very happy to ditch the idea. I mean, if you're challenged and the challenge is a strong one and you really don't have an answer, then you should give up. But what we have done is we've taken on those challenges. Jane does the research, do your research, and modify the idea, make it better, and so on and so forth. And before we start the trial, or when we start the work in January on the ground, we will have a 6-month period where we will be testing the basic elements of trial in the field and doing test runs before we actually go into the 12 months sort of steady state.
No, it looks like they froze.
Are they off?
I'm not sure, but we should continue, and when they hop back on, we can make sure to go back to their answer. Chloe?
Thank you, Simon. That was wonderful. And would anyone else like to respond? Have you done things differently, Jennifer?
With the Unite for Sex model, we work directly with those local iconic partners that I mentioned, and it's truly an honor and privilege to support those local doctors. So many of the strategies and healthcare practices that Unite for Sight utilizes and also spreads across all of our partner clinics in Ghana, Honduras, and India have been derived from specific doctors that we work with in the other clinics. So there's a constant exchange of ideas across all of the clinic partners. And since the programs are locally led and managed by those local doctors, all of the programs are really tailored and targeted for those local communities. And many of the clinics in Ghana, for example, provide eye care to numerous regions throughout the country, and they also have to tailor and target their strategies just based on the specific community where they are working and the specific barriers to care that exist within that community. So there's a lot of flexibility required, but also utilizing the expertise and amazing talent of those local doctors. And an additional strategy that we utilize is research studies, so that we and our partner eye clinics are able to further understand the barriers that impact each patient, because of course there are a general broad overview of barriers that affect many patients, but each patient has their own specific barriers to care. So we utilize Global Impact Fellow volunteers, many students, for example, and professionals from the US, Canada, Australia, Europe, many different countries. And they work with Unite for Sight and our partner clinics to develop these research studies based on the needs of each partner clinic. And they receive institutional review board IRB approval from their university IRB, travel abroad, conduct the research to better understand these various patient barriers to care, and then we receive that data and analyze it, provide it to each clinic partner to further constantly enhance the programs of those particular partners. So we're able to then utilize that amazing expertise of the local doctors in combination with research studies to further enhance their understanding of these the hardest to reach patients, so that they're able to reach more and more patients each year as well.
Great, thank you. And Vera, for you and your team, what are some of the similarities or differences that you have here? And if you both have questions for each other, or questions across the group or comments, feel free to add those as well.
Yes, I would like to mention that we are now in a very good moment, because we spent 20 years, improving our social methodology. Now we know to explain the whole country exactly what the result, and to involve the civil society more and more in the work, because Brazil is a dimensional country, such a continental country, and there's no a very well developed culture of philanthropy. So there's a huge gap between the rich and the poor. So at that moment, we are starting a huge campaign to, to explain the results and how we are promoting social inclusion of the very poor. So other people can do whatever they want, following our rules. So that's one thing. The other thing is we are improving our for-profit branch, selling Saúde Criança products, because I understood as I saw our G and other projects all over the world, they are improving their for-profit branch in order not to be so dependent in sponsors, companies, etc. So we will start selling our product through the internet in many ways. And as we know that the rich people, they are inside the shopping centers all over the world. We are trying to have kiosks selling Saúde Criança products as much as we can. And another thing, there is a group of Georgetown University making a research with a control group, a family that doesn't have Saúde Criança program. How this family goes in their life, how she lives, and comparing with Saúde Criança families that has already been discharged from the program 3 years ago. So they are studying, the group of Georgetown, the long-term impact into the families. So next year you have the results of this important long-term impact research.
And Jennifer, I know that based on Vera's comments, I know that the Unite for Sight model also has some interesting kind of cross subsidization of different products, so that you're able to do your work on the ground, but then you have different partners around the world. So as Vera was mentioning, the different strategies to diversify in terms of fundraising, could you kind of speak to some of your experiences there as well?
Unite for Sight has 4 different program divisions, and each of those program divisions generate revenue for our programs. So one of those program divisions is the international programs. And I mentioned that Global Impact Corps, where we have a lot of volunteers who pursue research, also those who don't pursue research, but those who support and assist the local doctors. And each of those 300 volunteers each year are required to fundraise for Unite for Sight's programs, with 100% of that going directly to funding the provision of eye care for the patients living in extreme poverty. So that generates revenue for our international programs. We also have chapters at universities in North America where there are students who fundraise on their campuses using various fundraising strategies. And again, 100% of all of that fundraising goes directly to providing the eye care for the patients living in extreme poverty in Ghana, Honduras, and India. We also have Global Health University, which are online, freely available public online courses about all different strategies within global health, social entrepreneurship, international development. There are now about 70 different online courses and certificate programs. And they're freely available, but also people can choose to register and enroll and submit reading responses about the various materials, the educational materials, and then receive a certificate. And those registration fees from the certificates also are generated directly for program revenue for those international programs. And then our fourth program division is our Global Health and Innovation Conference, which again is able to generate revenue for our programs. So we have each of these different program divisions which are generating revenue, in addition, of course, to the larger standard types of donations and grants and things like that, but we also really target each of our programs so that they are able to generate revenue to run our programs. And then 100% of the donations that we generate through those Global Impact Corps programs, chapters, and then just standard donations 100% always goes directly to providing that eye care. So we use a very, very cost-effective model as well, where we are funding the expenses for patients who are otherwise unable to access or pay for the care. So rather than billing the patient for the surgical cost in Ghana, for example, or Honduras, the clinic instead bills Unite for Sight for each of those patients.
Wonderful, thank you. And I think the revenue model and kind of sustainability model of Unite for Sight is definitely something that I know that the Changemakers team was quite impressed with, having seen so many innovations around health. It was really kind of refreshing and encouraging to see kind of innovation not only in the provision of healthcare, but also in the sustainability of an organization. So that's just wonderful. And now I wanted to pass over to the Next Billion team to see if you guys have any questions for the winners.
Okay, I was thinking about something here. Usually when people start some project, they have just an idea of what they want. And now I would like to know if the social impact that all these winners has today, if they thought that would be like this when they first began. I would like you to talk about a little bit about the social impact, please.
So I can start. So I remember the beginning, 20
Would you like
years
to
ago.
start, Vera?
Yes, can I start? Are you reading me? Yes, I want to start. What happened?
Go ahead,
Vera, you can start.
Go ahead.
I can start. Okay. So I still remember in the beginning when I have no idea what we'll do, to break this vicious cycle of hospitalization. I started raffling things off my house, and since the very beginning of the work, I realized that we touched the heart of many people. So the civil society in Rio started, to mobilize, to call each other like a wave, And since the very, very beginning, I knew we as a group had touched the heart of a very, very important issue, And after 20 years, but to tell the truth, I remember only the priests, they believed at us. They came, they started to, but no company, no big sponsor. And Ashaka was a milestone in the history of our lives, because I remember we have only 1 year of the institution, and I was elected an Ashaka fellow. And I still remember the clothes I were using, because like I had the feeling that some people very far from us knew that we wanted to change the world. But at that time, it was crazy, because at that time we had nothing. Just some beans, rice, very simple things. But, our willing to change was so strong as a group that I think mobilized Ashaka, and we had the same energy and synchronicity, and everything started to change when I was elected Ashaka Fellow. Then, 5,000 hours from McKinsey to help us to have rules to build the social methodology, and then all the other sponsors that came to help us. So, talking about the social impact, when we were we are applying for the SCORE Award in 2006, we have to prove the concept, the social impact. And we have all the database of the family assistant in Brazil. But then they asked, how, if you could prove at that time that we are calling our mission, break the number of his hospitalization. And we could, because we have everything in a database, and we saw that 60% of the children that were in the program, the rehabilitation falls down. So when we could prove through numbers, through testimony of the families that are the best thing, when you see the family and they speak, my life is totally different. I can walk by myself. I am self-sustainable. My child is well now. So those testimony and the numbers that show that we really impact, the life of thousands of people, that gave us energy to keep going.
And are there any responses or follow-up questions? Would anyone like to, from your team, like to add anything to those that haven't said anything yet? Hank, you're being called on.
Yeah, well, actually, I had a question for Jennifer that I was going to ask later. A core of volunteers, and then you have a lot of student chapters at colleges. And in fact, I remember that at my school there was a chapter 2, and Unite for Sight was always being advertised at my school's office for international internships. And I think as a volunteer here at Saúde e Criança, I'm just wondering, because Saúde e Criança is also thinking about implementing sort of an international volunteer program as well. So could you just talk a little bit more about your strategy for implementing a program for international volunteers, like how you advertise at universities, how you sort of find how volunteers could fit within your program, and things like that?
It's great to hear you're interested and involved in volunteers. They're such a remarkable source of energy and dedication and commitment, and we love working with our volunteers. And we have quite a comprehensive process for the Global Impact Core program. So we have a lot of volunteers who hear about us through word of mouth from past volunteers, for example, who participated. And we engage actually a lot of our most stellar past volunteers as campus representatives. And they then serve on their campus and share information about Unite for Sight's programs, do information sessions, for example, and encourage others to apply to participate in the programs. And that campus representative position is very selective, so it is the most stellar past volunteers that we select for it based on evaluations that we receive about each volunteer from our partner iClinics. And all of the volunteers participating in the international programs, their role is to support and assist the local doctors. And there's also a comprehensive process before they participate. So it's not simply that they register and then arrive abroad, for example. Instead, there is an application process, which is very similar to a university admissions process. We actually use the same software technology as a lot of university admissions offices. We submit short essay questions, letters of recommendation, and we find the recommendations particularly critical. And then we evaluate the application, decide whether they will be accepted, and then if they are accepted, then they proceed to prepare to participate internationally with the local partner clinics. So that preparation involves a lot of training about global health, social entrepreneurship, international development, so that once they arrive abroad, they already have this firm understanding about how the Unite for Sight programs operate, best practices within global health, the importance of supporting and assisting those local doctors, and also they understand their specific role, which is to assist with things like patient intake, visual acuity screening, patient education, distributing the glasses and medication prescribed by the local doctors, so that then the local doctors are the one, they're able to provide all of the exams, the diagnosis, treatment to 100 to 300 patients each day because of those visiting volunteers as well as local volunteers who are able to assist with these other support components. So we have remarkable volunteers who assist in that capacity. And then, as I mentioned, also a lot who pursue research studies, which are particularly effective and very helpful for those local iconic partners. So it really is a very comprehensive process from the application to the training to then when they return abroad and we receive evaluations about each of them, selecting them for campus representatives who then are able to spread the word about Unite for Sight on their campuses, but then also utilizing internet and social media, Facebook, for example, and a lot of those types of strategies to recruit those who are interested in applying to participate. But I'd be happy to share any additional information as well if you have any questions along the way as you continue thinking about it.
Yeah, that sounds really great. Just one more question. Do you fund all the volunteers, as in the housing, their air flight, or is that just taken care of by past funders?
So all the volunteers fund their own expenses. So Unite for Sight's funding is not used in any way for any travel expenses. Instead, the volunteers pay their own and coordinate their own flights, for example, and their own living and lodging expenses. We coordinate where they will be lodging, so everyone is in the same location. But then they pay those expenses directly to the guest house or directly to the hotel. Similarly, they pay it directly to the airline. And actually, a lot of university students are able to receive fellowships from their university to fund those expenses. But many of the volunteers are not personally funding it, but actually receiving the funding from their universities.
Oh yeah, I remember. That was the same at my university as well.
Which university had you gone to?
I went to Princeton.
Okay, great. We've had terrific volunteers from there.
Okay, but great. If we have any questions, we'll be sure to let you know.
Excellent.
Wonderful, thank you. And it's always great to see inter collaboration happening. And my last question, just conscious that we're running out of time, is I'd love if we could just discuss what is it that you would hope that the rest of the global community, whether that's global health community, the health and innovation community, or just practitioners in this space, what should we be learning from your solutions and models? Either the things that you've done really, really well, or also from maybe one or two of the mistakes or specific challenges that you've had?
I think it's especially critical for everyone involved with healthcare delivery, especially internationally, to support and assist those local doctors. And as I mentioned earlier, they have that amazing expertise of their local communities. They also have incredible ideas. And by simply providing them support in resources, financial resources, for example, human resources, they're able to do so much. And there's so many incredible ophthalmologists and their outreach teams that we work with, and one in particular has been the only ophthalmologist for 2 million people in the entire northern region of Ghana, and he had not actually been able to provide any surgeries for patients prior to 2004, and because he didn't have the operating equipment and the patients were not able to fund their expenses. And we were able to then partner with him, and now he provides eye care along with his team to 65,000 patients a year, and he personally provides 2,800 sight restore and cataract surgeries. So it's just incredible to see how just some support is able to enable those local doctors to do so much, and they're just so inspiring, and it's really an honor to have the opportunity to work with them.
And Derek, do you have any comments?
Yes, I wanted to share something that I learned during those 20 years. One mistake that we did, I cannot say it was a mistake. I think it was a wrong path. Now we change. But first of all, I want to say that I think health program or social program needs time, because it's not easy to make a huge impact in people's lives. It's not easy. First of all, I'm talking about Brazil. For a developing country, to start with a huge impact when you are very small. You have to pass through all the pains of the growth of the institution. That means lack of money, that links lack of better organization. You have to improve step by step, day by day. And just to share one thing that we did well at the time, but then happened to not work anymore. For example, we were a network of 23 sister organizations based in our model. But as a network, despite we made a lot of effort, to transfer the methodology, I realized in some point that we have to change the governance. Instead of network, transform in franchise model, social franchise model, to care about the quality of each franchise group. I think one of the mistakes the social entrepreneurs many times can do is attempted to do, there are temptation to do, is to spread without quality. So I think I prefer in nowadays to stay not so big and to improve and to really care about each unity of the franchise group, to maintain the quality, the DNA of each unity, because this is the very important thing, to grow with quality.
So I think that comment, that your perspective is wonderful, and I think the quality and driving home the. Go ahead, Vicky.
No, I'm thinking I was going to say the same of you, but close the session and then
I was just going to say that I agree that the point of driving home the need for quality in healthcare is extremely important. So thank you all for your time, and I hope this has been valuable for you. And now, Vicky, I'm passing it over to.
Just a last thank you note. I think this has been extremely interesting for all of us. All the discussions and to get your models better. This has been a great opportunity to get to know the very, very wonderful work you are doing. And it's not because you are the competition winner, because we get to reading your entries and getting more information about what you are doing. We get more and more amazed about all the commitment and all the people and all the resources and all the time and passion you use, and that is reflected on the impact and the results of your models. And we know that the change makers competition is just a recognition, but you deserve to earn millions of other awards because of the work you're doing. But we really want to congratulate again, not only for winning the competition, because of the daily work you have been doing for many years now. And I think this is a very nice space and very nice opportunity. And I'm really, in this moment, I'm really inspired to see if we can have other opportunities to have this kind of discussions, because there are not many opportunities without that doesn't involve a lot of logistical resources to get such strong innovators and strong models in health as you to discuss and to share their ideas. So maybe we can think about having other hangouts or calls or any other kind of spaces where we can continue our discussions. From now, thank you very, very much for all your timing, for all your commitment, for being here with such late notice. And we'll officially celebrate tomorrow when we announce our winners. But this is an open space. We would like to continue being communicated with you and also supported through our chain shops that you are starting to build that. So this is an open challenge with the Changemakers community and with all our partners and team.
So thank you everyone, and once again, please feel free to stay in touch with us online. If you are, just in case you're not familiar, this is, I'm going to send over our Twitter account. It's Changemakers. We're also on Facebook, and as we move forward, stay in touch with the people you've been in touch with through the competition, but also feel free to connect with us through our online channels.
Well.